Hello, welcome to another mental health tip from Sun Valley Behavioral. I'm Dr. Bernardo Ng, psychiatrist and medical director of Sun Valley Behavioral. Okay, today we're going to talk about depression. So, what is the problem with depression? What's wrong with getting sad once in a while? Nothing wrong with that. The problem is that depression is not getting sad once in a while. In fact, sometimes it's not even getting sad. Depression, which has been named that way for centuries now. Centuries, believe it or not. Even before the birth of Christ, the Greeks already had depression in their books of medicine. So it's a very old condition. It's a real condition. And even though it's a disease of the brain, it gets manifested in your entire body. So what happens? Certain key places of the brain, like the limbic system where all the emotions live, the hippocampus, which has to do with memory and concentration, and the frontolateral cortex, prefrontal cortex, they get out of whack. Some of them work very little, others work a lot. Point is that things in front of you suddenly become hard. You cannot focus, you cannot process information, you become hesitant, unable to make decisions. And of course, that makes you sad or irritable. Yes, it's more common for it to manifest as sadness in women, but more common for it to manifest as irritability in men. Okay? So if your husband, your father, your friend, their man, and they, for the last few weeks or months, have become very touchy, easily irritable, and you don't even know why. You hardly say anything, and he doesn't want to talk about it anymore, is upset. Could be depression. Okay, but what else is going on? I said that it invades the whole body. Because once this process begins in the brain, it starts to affect not only your mood, but also your sleep. Usually you sleep less and you're very tired during the day, so it affects your energy. I already said it affects your concentration. It also can affect your appetite, where you could be eating a lot less and losing weight, or eating just for eating and don't even enjoy food anymore, but keep on eating and gain weight. And the most destructive and risky process in depression: thoughts of guilt, disappointment, resentment, helplessness, worthlessness, desire to die, or even thoughts of killing yourself. And unfortunately, yes, anywhere from 10 to 15% of untreated depression end up in suicide. And also, even people with treatment can end in suicide. So, it's a deadly illness that is the number one cause of disability around the world, and very, very common. Okay? What are we talking? 12 to 14%, 16%? So about 1 in every 5 or 6 people either have depression or have had depression or will have depression at one time in their lives. So when someone starts to have these symptoms, you need to seek medical help. Okay? The evaluation includes physical exam, your weight, your vital signs. We need to do lab work to check your thyroid, to check your hemoglobin, to check your blood sugar. And then the treatment varies depending on the severity. Okay? It could include psychotherapy. The most common form of therapy with great success is called cognitive behavioral therapy. There are others, but that's the most commonly used. Or medication. There's a huge family called antidepressants, most of them with very tolerable side effects, a high level of safety, and very easy to take. Usually it's once a day. When that doesn't work, we have other forms of treatment that include boosters of the antidepressant in the form of pills, liquid, or nasal spray, and something else called neuromodulation that I'll be talking in other videos, including transcranial magnetic stimulation or electroconvulsive therapy. These are treatments that I will be talking about in another video, but the main thing is that they use either alternate current in the form of magnetic pulses or actual current to stimulate the brain. Okay, so if you start to have these symptoms, don't wait. Okay, unfortunately, people sometimes wait for years, and I wish you could understand that when you're going through depression, the brain is dying little by little, as if it's having a fire. Like if you think of it as if your brain was the forest, and you have little fires here in the hippocampus on the left side, and then also on the hippocampus on the other side, in the amygdala of the left side, in the left frontal cortex, in the right frontal cortex, until it starts to go down. The more you wait, the harder it is to see or hope that the treatments will work. So don't wait. There are certain levels of depression that don't need any medication. They need what we call activation therapy, dietary changes, physical exercise. So let us know and contact us. Our number is 355-0161, or find more information on our website, www.sunvalleyb.com. Thank you for listening to this mental health tip from Sun Valley Behavior.